my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation,
and I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
And been facing difficulty in speech. You are able to speak words properly and sentences properly.
just you try to say something.
treatment is set there. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, Voice Therapist. And today we are live, and today we are before treatment live with a girl whose age is 10 years and she's having unilateral vocal cord paralysis. So you can listen her voice and in this live, and in the future we are going to be post-treatment live too. So please subscribe our YouTube channel and don't forget to watch her post-treatment live as well. So नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे. और आज हमारे साथ एक 10 साल की लड़की है जिसकी आवाज़ जो है वो अफेक्टेड हुई है. उनका एक साइड का वोकल कॉर्ड पैरालाइज्ड हो गया है. तो आप उनकी आवाज़ को सुनेंगे और भविष्य में जब हम लोग ट्रीटमेंट कंप्लीट कर लेंगे तब फिर से आपको उनकी आवाज़ सुनाऊंगा ताकि आप लोग प्री और पोस्ट ट्रीटमेंट में चेंजेस देख सकें. और आज डेट है 28 जनवरी 2022. सो इसके लिए आप हमारे यूट्यूब चैनल के को सब्सक्राइब करके बेल आइकन को प्रेस कर सकते हैं. और इस लाइव में हम लोग और भी चीज़ों के बारे में चर्चा करेंगे. विल बी डिस्कस सो मेनी थिंग्स इन दिस लाइव because she is having the vocal cord paralysis. So we'll discuss about the vocal cord paralysis symptoms. We'll also discuss about the cause of vocal cord paralysis and what we'll do in the treatment of this dysphonia due to the vocal cord paralysis. We'll talk about the speech production mechanism. And we'll also talk about the other communication disorder for which we provide our services. And I'll be giving few tips, those who are our YouTube channel's fans, to how to keep your voice healthy. That will be general information in this live. And even I'll be talking about how do you know your voice therapy service provider is not a healthcare quacks. There are so many healthcare quacks, they are working in the name of speech therapy or voice therapy. So how you can differentiate between fake and the real speech therapist. And I'll be also discussing if you are from India and how to report a fake speech therapist if he is harming you by any means. So where to report. So I'll be discussing about that. And I will also discuss about that why should avoid service from healthcare quacks, how it can damage the voice and vocal cords. On that point we will be discussing. So before that I will suggest please tell us what exactly problem you are facing.
Hi, my name is Akshita. So on 19th November, I couldn't swallow food, and whenever I drank water, I would just cough a lot, and most of the time I would vomit it out. But that resolved in a few days. But my voice became really low. It improved a bit, but not completely. On 7th or 8th December, we did like laryngoscopy, and from that we found out my left vocal cord was paralyzed.
Okay, so nicely you explained. I want to suggest your mom. You want to say something about her problem? Please come in front. Yeah.
Yeah. So as she already mentioned, her left vocal cord is paralyzed. Then my ENT specialist suggested she should go for some voice therapy. And I searched YouTube and I found Sir's video very encouraging. And then we contacted him, and today we are starting the voice therapy for her.
Yeah, in fact, you are not in India, and that place Skype doesn't work. So we are on the Google Meet usually. I give therapy on the Skype. So of course, by online voice therapy will be helping.
Yeah.
Okay. So, but basically, from you are from India, but at present you are not in India.
Correct. Yeah.
Okay, Akshita, please mute your mic. And now I'll be talking about what I told one by one. Maybe it will help you also to understand about your problem and your family as well. So I'll be talking about the vocal cord paralysis symptoms. Before that, I'll introduce myself also for the new people, those who are at my YouTube channel new. My name is SLP Sanjay Kumar. SLP means Speech Language Pathologist. So, and I have studied from AIIMS Delhi. I did my graduation from All Indian Institute of Medical Science, New Delhi, in the field of speech and hearing science. And I did my post-graduation in the field of speech language pathology from the University of Mysore. And my area of interest is treating voice and speech disorder. And today with us, Akshita is here, and she is having unilateral vocal cord paralysis. And she is not in India, she is in a different country. In fact, their Skype doesn't work. So we are on the Google Meet today. And yeah, so I told we'll be discussing few points. So let's start. So vocal cord paralysis symptoms, let's discuss on that. So whenever any patient will be having the vocal cord paralysis, they will be having breathiness in the voice, loudness will be low, and hoarseness will be there. So if this kind of symptoms persist for more than 2 weeks, so you should consult a healthcare professional like speech language pathologist, otolaryngologist to check the vocal cords and any other problem is there or not. And we'll be also discussing causes of vocal cord paralysis. So we have seen, based on my clinical experience, I have seen the vocal cord paralysis patient after thyroidectomy, after thyroid surgery. I have seen the patient who had a history of a viral infection or bacterial infection or injury in the throat or a history of vocal abuse. Sometimes some patient, I have seen there was recently one patient came to our center, and we in fact started the online voice therapy, and he took some wrong vocal exercise and it was equivalent to vocal abuse and shouting. And after that, actually he was having a pitch problem. Like he was a male and his voice was a feminine kind of voice. But because of the vocal abuse, wrong vocal exercise, he developed the vocal cord paralysis. So I'll put that link also, that patient's voice and how it was, and we already did the live as well. So whenever you are taking treatment, always you should take from a professional, not from the healthcare quack, and never try the self-treatment. And yeah, so treatment of dysphonia due to the vocal cord paralysis. To understand that, let's first understand the normal speech production mechanism. That will give us an idea how we are going to treat the problem what Akshita is having, voice problem due to the unilateral vocal cord paralysis. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cords. Like here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. And like here we have larynx. Inside the larynx, we have two string-like structures. And that sound, what we generate at the level of the vocal cord, we modify into different sound with the help of our lips, tongue, jaw, teeth, palate. These are known as articulators. For example, if you want to say paw, both the lips are coming closer together and touching each other. When you want to say the, tongue is coming between the teeth. When you want to say ka, back up, the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say one sentence, So many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord. Vocal cords move, sounds generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound's own place, own manner of articulation. So it is little complex process. And if coordination among these muscles will not be there with the brain, there will be fluency problem. That can be seen in case of a stammering or a stuttering. If there is a place of articulation, manner of articulation is wrong, there will be pronunciation problem. You must have seen some children will be saying tat for cat, for ram they'll be saying lam. So that will be the pronunciation problem. And here what Akshita is having, her one vocal cord is not moving. And sometimes the vocal cord paralysis can be due to the idiopathic reason, means we don't know the reason. It can be bacterial, it can be viral, it can be due to the injury, surgery, or sometimes idiopathic. We don't know exactly the reason. So because of the one vocal cord is paralyzed, left vocal cord is paralyzed, there is a gap creating between the two vocal cords. And because of that gap, technically we call phonatory gap, air is escaping. And that's why our loudness is less and breathiness is there. Like as I told, here we have larynx. Inside the larynx, we have two string-like structure known as vocal cords. So once you put air pressure below the vocal cords start moving like a string for violin and guitar and sounds generate. And then we modify that sound into different sound with the help of our articulators. So now suppose one vocal cord is paralyzed, left is paralyzed. So when you speak, for example, we are saying this sound if I'm producing, so both the vocal cords move and they will come closer together also. There will be very minute gap will be there to pass the air. But left vocal cord is paralyzed. So right is coming towards the left, but left is not coming towards the right. So there is a gap creating between the vocal cord. And because of that gap, when to speak, when you are putting air pressure below the vocal cord, lots of air are escaping. And because of the air escape, the energy which was used to vibrate the vocal cord is getting wasted, and the amplitude of vibration of the vocal cord is less, and that's why the loudness is less, breathiness is there, and even both the vocal cords are not in unison, so the hoarseness is also there. So what I will be doing as a speech language pathologist, because I told we'll be talking about the treatment also, I will try to bring the left vocal cords by stimulating with a certain vocal cord to start, it should start moving. There can be one option. Like the paralyzed vocal cord will start moving. There can be other situation where I will not be able to move the paralyzed vocal cord. In that situation, what I will do, I'll bring the right vocal cord more towards the left. So the air gap will reduce in both the situation, and the amplitude of vibration of the vocal cord will increase, and the loudness will increase, and the voice quality will improve. And so that was, we talked about the treatment and the speech production mechanism. Let's discuss about the other communication disorder for which we provide our services. To understand what are the services we provide at our center, please refer our YouTube channel's playlist. You will find different communication disorder playlists, and there will be pre and post treatment videos also. So if you'll explore our YouTube channel playlist, you will find the playlist of vocal cord paralysis, high pitch voice, puberphonia, stammering, functional aphonia, functional dysphonia, phonatory gap, sulcus vocalis, spasmodic dysphonia, misarticulation, aphasia which happened after the stroke, and after hearing testing, once we dispensed and fitted the hearing aid, how the patient communication improved. So this kind of video you will be able to find, and all the playlists will be having pre and post treatment videos, and there will be some educational videos also. So my suggestion is please explore our YouTube channel playlist and share that also, so that people having communication problem, they can get information and they can reach to a right place. And I had a plan to talk about the tips to keep your voice healthy. So that will be helpful for the professional voice users, even those who are having the communication problem and those who are not having the communication problem. So this few tips I'm going to tell. You should drink plenty of water. Water is a very good lubricant. So when we speak, the vocal cords moves. When you drink plenty of water, what will be happen? Proper lubrication will be there. So the vocal cord will not become dry, and you can use your vocal cord for a long time without harming it. We have seen in the teachers and the singers, vocal nodule, and even those who shout, the street vendors, the vocal nodule. So if you're drinking water, it will be helping to you to keep your voice healthy for long duration. So 10 to 12 glass drinking water is a good idea. So you should drink plenty of water, and you should not shout. Suppose you are a teacher and the classroom is big. So if you want to speak to a big classroom, you can talk to your management to provide the amplification device, because when we shout, there will be a lot of stress in the vocal cord, and that may damage, and sometimes it may result into the vocal nodule. So you should drink plenty of water. You should avoid shouting, and those who are a smoker, they may develop the vocal cord polyp. So you should avoid smoking to keep your voice healthy. And there are some people will be having the habit of doing like this, lots of throat clearing kind of habit. So avoid that, because frequent throat clearing can damage the vocal cord. And don't drink very cold and very hot things. That may also not good for the voice. And you must have a habit to just do some physical exercise like jogging, walking, or doing yoga, or going to the gym. The proper blood circulation also support your voice quality. And so these are the few tips, and it will be helpful for everyone. It's not like those who are having the voice problem. So this may be helpful for somebody. And even I had a plan to talk about how do you know your voice therapy service provider is not a healthcare quacks. So this is the time of social media, and in this time, some people, those who go to the speech therapist, and they will see what a speech therapist has done because of unemployment, they will try to replicate the technique to the people having the problem. So sometime it may help, and that time they will consider they have become a speech therapist without studying the speech language pathology. And sometimes wrong vocal exercise or wrong way of doing vocal exercise may damage the voice and vocal cords. So always try to take help from the certified speech language pathologist. So how will be doing who are certified? So first thing you should come in your mind is where your speech language pathologist has studied. Hello? Can you hear me?
Yeah, I can hear you.
Yeah, it's no problem. Let's go ahead. So first thing it should come in your mind is where your speech language pathologist has studied. What is the college when you are going to start the speech therapy or voice therapy? Then what degree he or she is having, bachelor degree or master degree. In India, even the bachelor degree, those who are having, they are eligible to work. But in USA, like countries, you must have master degree to work as a speech language pathologist or a speech therapist. So you must have to inquire the degree, and your therapist, speech therapist or speech language pathologist is having registration in the Rehabilitation Council of India or not. Okay, and if is registered or not, that also you should try to find out. And also you should check the RCI number, Rehabilitation Council of India's number, RCI number, if you are taking help from the Indian speech language pathologist. So means what you have to find out, where he has studied, and what degree he or she is having, and what is the registration number, RCI number, Rehabilitation Council of India number. So these all things you must inquire, because in the social media, any healthcare quacks can write XYZ ABCD degree from A to Z letter. But those who will be healthcare quacks, they will not mention in their about section of YouTube channel or any other social media pages, like what was the college and university. So that will give you an idea like, okay, he or may be real or he may be fake. And where to report about the fake speech therapist and audiologist. In case suppose some fake speech therapist and audiologist is harming to you by any means, so you can report to the Rehabilitation Council of India. Rehabilitation Council of India will take strong legal action. So that is the responsibility of any responsible citizen. And why you should avoid service from healthcare quacks. So I told, if you are taking service from healthcare quacks, it may be very economical because they have to just copy with some of the professionals. So they will take very less fee, but it may damage your voice and the vocal cords sometimes. Recently, one patient who took therapy from a healthcare quack and he developed the vocal cord paralysis, but he was trying to treat his feminine voice. He was a male and he was trying to treat his feminine voice, high pitch voice, and that was resulted into the vocal cord paralysis. So voice therapy is not a joke. Also, don't do self-treatment and don't take services from the healthcare quacks. So now we'll stop this live. From 5 o'clock I have the appointment. So Akshita, just tell us in just few sentences what exactly problem you are facing, and then we'll stop this live. You can repeat again.
Yeah, so basically, about 3 months ago, basically like I couldn't swallow properly. Like I would eat really slowly, and when I drank water, I would just vomit it out or cough a lot. And but that like got resolved, but still my voice was really low and hoarse and breathy. Now it's a bit better, but it's still not loud, so that's why I came here.
Okay, thank you so much, Akshita and your mom, so supporting me to create awareness about the communication disorder by the YouTube live. So I really appreciate both of you. Thank you. We'll stop this live, and thank you all those who are watching this live. And thanks for asking question. Maybe I was not able to give the answer. I will try to give the answer for in the next live. But I want to thank you, Murari Roy, and thank you, Shiv Kumar, and thank you, Transport Ki Dunia. Thank you, Avinash. And thank you, everyone, for joining and watching us. And please write any question if you have in the comment box. We'll try to give in the next live. Thank you all. Thank you so much. And thank you, Akshita, and your mom.